Hello, my name is Dr. Paul Harrison and I'm from the University of Birmingham in the UK. It's a great pleasure to give this talk on behalf of the ICSH and the JCTLM on World Metrology Day. Today's topic is platelet counting standardization, and this is a perfect fit with the theme of Metrology Day this year, measurement for health. So as we know, haematology is defined as the study of blood. When blood samples are centrifuged, you can see that blood is composed of 55% plasma and 45% of cells. There are three main types of cells in the blood: the red cells, the white cells, and the platelets. In a modern pathology lab, one of the most requested tests is the full blood count, which is performed nowadays on large, fully automated analyzers that are capable of measuring thousands of samples in a working day. A full blood count accurately determines not only the type of each cell, but whether their number, size, and morphology are normal or abnormal, and therefore can rapidly determine if a patient has an inherited or an acquired hematology disorder. But the question is, how does a laboratory guarantee that the results produced from these blood counters are indeed accurate? So the ICSH, the International Council for Standardization in Haematology, was set up in the 1960s as an international organization to help ensure that testing of blood is performed accurately worldwide. To do this, the ICSH has historically developed many standards and guidelines for all blood testing laboratories throughout the world. And one very important aspect is to develop standardized reference methods for measuring all cells in the blood, including platelets. So we are now working closely together with the ICSH to develop new reference methods for all cell counts, including platelets. Why are platelets so important? Well, they are the second most numerous cell in the blood to the red cells. You can see it on a blood smear, the smaller platelets compared to their bigger red cell cousins. They usually, in an average adult, there are about 1 trillion platelets in the total blood circulating at any one time. And the count is normally between 150 to 450 million platelets in a single milliliter of blood. Their lifespan is short, only 10 days, which means if you do the mathematics, you need to produce 1 million new platelets every second just to maintain a normal platelet count. Platelets are much smaller than the red cells. They are only 2 to 3 microns in diameter, and electron microscope pictures show these beautiful resting flattened disc platelets. Now, one of the things that happens is when they become activated, they change shape and they start interacting to form platelet aggregates. And this is their main function in the blood. They are monitoring the vessel wall integrity on a constant basis. And if the vessel wall becomes damaged during tissue injury and there is bleeding, the platelets will rush into that area of damage, form aggregates and a clot, and stop the bleeding from occurring very efficiently. The problem comes is in patients with low platelet counts. This process is less efficient, and therefore there is an increased risk of prolonged bleeding and severe bleeding, especially if the platelet count is very low. Professor Gustav Born was a pioneer in platelet biology and biochemistry. And remarkably, in 1945, he was in Hiroshima, and among the awful injuries he encountered, he actually discovered that many of the survivors were suffering from severe bleeding. And this, he suggested, was caused by the lack of blood platelets and low platelet counts caused by radiation damage to the bone marrow. So in other words, the bone marrow stopped producing new platelets. This can be seen on this picture. This shows classical microbleeds in the skin of a patient with severe thrombocytopenia. These are called petechiae, and this is one of the ways of diagnosing a platelet bleeding defect and thrombocytopenia. So platelet counting is therefore very important to assist us in the diagnosis of various clinical disorders. Platelet counts may be low, normal, or high in a wide number of different diseases. Low platelet counts, as we've just suggested, increase the risk of bleeding, and interestingly, recently have been associated with the severity of COVID-19 disease. If patients have very low platelet counts, platelet transfusions are often used to correct these counts and to stop the bleeding and decrease the bleeding risk. So therefore, platelet counting accuracy is important to appropriately treat patients. So we need to have a platelet transfusion trigger, which is usually set at about 10 million platelets per mil. And below or equal to that figure, you would normally give a platelet transfusion. And this is what platelets look like in a transfusion bag from the blood service. So shown here are a range of modern blood counters, which all use different measurement principles to determine blood cell counts, including platelets. Platelet counting accuracy is therefore very important. But to achieve this, these hematology instruments need to be calibrated using a sample with a known number of cells. This number is determined by an accurate and independent reference method. So this is where the ICSH comes in. So back in 2001, we published 2 papers on a new international reference method for platelet counting. And these papers are available in the American Journal of Clinical Pathology. What we did was to set up a flow cytometric method where we could detect fluorescent platelets. And we would label these with specific antibodies coupled to fluorescent molecules. And so this enables us to identify the platelets and resolve them from all other cells in the blood, and also any debris that might be in the blood as well. This method was superseded a previous manual approach to this counting, which was developed in the 1950s. So what this method enabled us to do was to assign values to calibration and quality control materials that are used in pathology labs to check that their analyzers are indeed producing accurate results. This indeed helps us improve platelet count accuracy, particularly in new generation hematology instruments that were using new technologies. This then informed correct clinical decisions, including platelet transfusions, and therefore improved patient healthcare. We are now working with the JCTLM to update the ICSH method into using modern recommendations and guidelines to actually improve the method. And what we will do when this method is ready and it's approved, we will publish this and share amongst the hematology community so that everybody can use it. So with that, I'd just like to thank both the ICSH and the JCTLM for allowing me to present today. Thank you very much for listening.